remember them.
Trust me, they will. So, diaphragm. Diaphragm standing. So, this whole rim is all going to be your diaphragm. Correct?
Right.
So this first little vessel kind of popping out right outside, right underneath the diaphragm, celiac trunk. See ya. She's very nice.
It's just nice.
She's nice. Are you guys very, very close as a class? Or is it
More like groups.
kind of like squads? Yeah, we got squads in Biscuit, yeah. Like, you know the different squads. Do you hang out with the different squads? Probably not.
I feel like some people, like we had our nursing retreat today. I'm like, I've never seen you before. And then there's nurses. I'm like, I have every class with you. Like I don't. Yeah, same.
But then, how are you going to get to know like 150 people? How big is your guys' class?
Oh, no, not 180. No, I think it's near
Because in this class alone, what do you guys have, like 270 people? This class is pretty big, isn't it?
This has some the other students. Yeah.
But even this lab specifically, there's like probably 2 or 3 people. It's the majority nursing, isn't it?
Yeah, that's true. Okay.
Yeah, because they just have the physical therapy in here, but
There's
there's not that many, I don't
An
think.
older guy over there who's a senior. He's biochemistry. And he's just trying to get one more requirement. That's it. So good. Yeah. But enough of that. So, first one. Here's the diaphragm. Another key. This is your aorta. Once your aorta punctures through the diaphragm, we're gonna call this the abdominal aorta. So that's the collective whole. Abdominal aorta. And then now you guys know these. You have your common iliac, external.
Iliac.
It's kind of across the inguinal ligament going to femoral. This is all right for you guys. Internal iliac. But we're concerned about all these little bumps. What's going on with those? So, that was the celiac, is the first one.
Celiac trunk.
Celiac trunk.
Okay.
Yep. Now we kind of have 2 side by side, 2 up and below, and 2 going wide. So we're kind of paired.
We got the superior mesenteric.
Superior mesenteric. So kind of how Ellie or Ellen? Ellie? So Ellie was talking about mesentery. And mesentery is kind of be pretty much the blood supply to the bulk of your small intestine. So kind of overlay that. We need blood vessels that are going to go to this whole area. And so if this is going to the very top, where we're at the top portion of your small intestine, that's superior mesentery. Superior mesentery. Now, worried about the lower gut, let's skip down a little bit. So here is superior mesentery. Skip these guys. We have inferior mesentery. Now, take a guess at these guys.
Gonadal.
Small,
Gonadal.
paired.
Gonadal.
Gonadal. So this is going to this is in females, ovaries, and in male, the testes. These 2 small arteries coming off the abdominal aorta, side by side. Gonadal. Yep. So gonads is another name for reproductive organs.
And then the other ones just on there are just the renals, and they would be tagged.
So what are you concerned about?
The left and right.
Yep. So we'll get to that. That's actually gonna be on the stomach.
Okay.
Because when you hear like gastrointestinal, stomach and intestinal doctor, gastropub, just like a pub that serves food's going to your stomach, that kind of stuff.
The right gastric's on the big part.
We'll get there in a second. So like I said, kind of a review real quick. What do we have up top?
The celiac trunk.
Sweet. Mary. Yeah, 1 above, 1 below. What are they?
It was superior, right? Superior.
Yeah, if it's above, it's superior. Exactly. Does that help?
Not really.
You know?
Mesenteric.
Yeah. And it's the one up top. So superior mesenteric. Let's take this away. It's still there, superior mesenteric. Down here, there's two little small ones together. Yep. Yeah, gonadal. Yeah, so those are the gonadals. You're gonna have one going to your left ovary, and one to your right ovary. Plain and simple. So here we have the superior mesenteric gonadal. This one must be the
Inferior.
inferior mesenteric. Exactly. Now another name for kidney, just how we had another name for the liver, we don't call them liveric arteries, we call them hepatic arteries. For the kidneys, we don't call them kidney arteries, we call them renal arteries. So these two red things going right to these kidney bean-shaped organs, they're the kidneys. That's the renal artery, 147.
The liver's hepatic.
Yep.
With this would also be the renal, right?
You got two kidneys, you got two
Every
arteries going to them, yeah.
Yeah. Where is the lumbar?
So-
Are those the
Lumbar.
Are the ones
lower,
here?
Lower spine, exactly. So this white part is supposed to be the vertebrae. That ocean blue is supposed to be the kind of the space in between the vertebrae. And then you have this gray blue is veins, red arteries. So these are going to be your lumbar arteries. You got them on both sides. See it okay?
Then we're going to